still very little known about the effect the virus has on pregnant women and if it can pass from mother to baby in the womb and during birth. Now, the uncertainty is causing confusion among pregnant women, as you can imagine. A study of 9 infected mothers-to-be who had COVID-19 symptoms suggest none of their babies were affected. Another study done on about 38 women who tested positive for COVID-19 shows that none of the newborns had the disease. Doctors say more research is needed, but it suggests the risk of mothers-to-child transmission is low. All right, let's speak now to our health correspondent, Nicola Hill, who joins us now live from London. Good to see you, Nicola. Do we know if pregnant women are more vulnerable to COVID-19?
Well, the actual answer to that is simply no at the moment. We don't know because there's so much that is unknown about the virus and about the disease that's caused by it. The WHO has put them in the vulnerable group because it's known that pregnant women are more badly affected by respiratory diseases. And so because of that reason, they are told to take more care and to have social distancing. But certainly in the UK, the Royal College of Obstetricians and Gynecologists, the RCOG, says there's been no evidence so far that they're any more seriously affected than any other normally healthy adult. And some very interesting research published this week in the New England Journal of Medicine showed that in 2 hospitals in New York, they tested all pregnant women, and they found that 14% of them were positive for the virus, but had simply no symptoms whatsoever. So we don't know exactly what effect it's having on both pregnant women and, as you said, on their newborn babies.
And what advice is being given to them, Nicola?
Well, the main advice to pregnant women is to still seek maternity care. There's a fear that a lot of women don't want to go to hospital, they don't want to put themselves or their newborn babies at risk. But one of the reasons we have so much more success in keeping babies alive these days, we have much lower infant mortality rates, is because of the excellent maternity care in most countries around the world. And so women are being told that they need to still attend the scans, the appointments, even though the numbers of those have been reduced dramatically, and to go to hospital to give birth if they need to, even though they may well bump into a midwife wearing full protective gear.
And how are they coping? Because surely they must be, this is a time of so much anxiety anyway for people who aren't pregnant. Imagine being pregnant at this time.
Exactly, Maria. I mean, I've spoken to 2 pregnant ladies, one in New York, one in London, and they share a lot of their fears and anxieties that you mentioned there. If I talk about Linda, first of all, in New York, she's 20 weeks pregnant. She's appropriately due on Labour Day in America. She was planning to give birth in a birthing unit in New York, which is midwife-led. And she still hopes that she can do that in September. But because of so many women being frightened of going to hospital, apparently this unit is being overwhelmed with pregnant women who are contacting saying, can we give birth here? Linda's scans have been reduced. She can't take her husband along. She's got a major one coming up next week. And she's sad that he won't be there to have that scan. You can see a picture of an ultrasound going on now on your screen. Instead, she apparently can FaceTime him. Now, she actually has family in Germany, and she said to me that it's highly unlikely her family will have ever seen her pregnant. And she also doesn't know when they're going to meet her baby, which is a fear that's being echoed by Laura here in London. Now, she's actually 33 weeks pregnant. She was going to be going into hospital to have her baby due at the end of next month, but she's now decided that instead she's going to go for a home birth. She's lucky because that hospital is still providing midwives to oversee home births, and because of charitable donations, they have an ambulance that will be standing by if she does need to go to hospital. But Laura says things might change in the 6 weeks or so when her baby's due. She too is having to go to appointments without her partner accompanying her. The reason she doesn't want to have a hospital birth is because although partners are now allowed to be in the delivery room, they're not allowed to be in the postnatal ward. So once the mother leaves and goes in the ward with the baby, the dads have to disappear. So because of that, Laura's decided that she's going to have a home birth. She's had Covid-19, she reckons. She certainly had all the symptoms and was sick for a couple of weeks. So that's made her feel more confident about allowing a midwife, strangers into her home. But she too, although she says she realises that she's lucky and she's just got to get on with it, we're all struggling. But she says the fact that she can't share the excitement, the fact she can't see her mum won't be there with her as soon as the baby's born, all these are very upsetting for pregnant women at the moment.
Absolutely, as you say, to share the excitement of this amazing time in their lives. Nicola Hill, thank you very much indeed. Appreciate it.